Hello, I'm going to demonstrate how to make the denture base and also wax rim and teeth setting. As you can see here, my case is immediate immediate RPD. So it already has a kind of semi-stable bite. I was able to take the bite registration, and there are teeth which are occluding. So I don't need to do the occlusion try-in, but I'm gonna do the aesthetic try-in. So what I'm gonna do is I will first make a denture base with the light cure custom tray material, and then I'm going to build the wax here, and I'm going to set the teeth. So before we do that, we need to block out the undercuts for this light cure custom tray material not to engage, so that it'll not be painful on the patient, and also it'll not damage the master case. This master case, we should not damage it because this was taken with PVS and also border molded. Everything is border molded, and it is the final impression. So keep it safe. Block out the undercuts if there are. So in my case, here are some undercuts. So I'm gonna use a pink wax to block it out. But you don't need to block out the areas where you're not going to put the custom tray material. I have a frame here, and hit it, and then just to cut it and adapt to block out the undercuts. So these areas, we see the sharp corners. Since this area is too separate, I don't need to remove this area. But here, this is my tissue separate, and I'm gonna remove this portion for me to adapt better the custom tray material. And then get the tryout. But before placing the tryout, one important thing is that we need to place the Vaseline. Apply the Vaseline well so that it'll not interfere. It'll be easier you to take out the custom tray material. You can use brush or anything that can help you to place this Vaseline. Okay, so only the places where you're gonna put. So since here is some bony sharp point where it might cause patient pain, so I'm gonna put some more. The patient complained about having pain on this side, so I'm gonna put some more wax on there. I recommend you to put this wax before doing the wax undercut block, because if you put Vaseline, it is difficult to place it, so it doesn't get stick. Good. So now it is time to place the tryout. With knife, trim. First, just to cut at the full depth of the sulcus. Cut around the teeth. If you're working on complete denture, it is the same. That you don't, even though the complete denture does not have a teeth, you don't need to. For complete denture, you don't need to cut the teeth side. But for now, since we have a teeth here, we're gonna cut around the teeth. Watch with the undercuts on the teeth as well. And out of them well. A color shelf. And then add places where you think you are lacking. Okay, add them a little bit more. And then cut the excess. I'm just using this tool, clarity discoid, large clarity discoid, to cut difficult area to reach and reinforce the areas where there are thin denture base. We don't want it to break, so reinforce it. And relieve the areas which needs relief. For instance, for here, the lingual plenum area. And then adapt. After cutting, every time you cut, adapt it again, because as you cut, you might leave the area. So this area needs to be a little bit more covered. And also this front area. And remove the undercut area here, the tooth undercut. And now we are ready to cure it. So I'm gonna bring it to the curing unit and cure it. Let's go. I'm gonna cure it for 3 minutes. It has been 3 minutes already. So let's try to take it out and trim it. I love to wear loops while I'm working on the model. That works because I'm using Dr. Kim's loop, and it is really giving me a comfort. I don't need to look down. I can work ergonomically even when I am working on a LabWorks. So always keeping my posture upright, it gives a lot of comfort. See that? Because of the teeth slightly touching, that's why relieving these areas are very important. So now we have a denture base. Now I'm going to trim it before I do the wax, put wax here. And for the IRPD or resin RPD, make sure that this area has enough thickness. The technique that I love to use is just to slightly pass it by or strike it several times like this with a very light touch. So just to give very light touch and scrub it back and forth, rounding it off all the sharp corners and line angle. Round off these sharp corners. If it is painful if there are some sharp corners because it is in contact with the gums. So round off everything. See how I'm passing it through and back and forth and cutting it. Steady with a gentle touch. Rub it like this. And I'm cutting this inner line angle and the outer line angle all the same time. So check whether it is sharp. Okay, done. Let's blow the air. Okay, now it is sitting well. It is pretty. I like it. And now put some wax. Let's do some wax work. So I'm going to make a occlusal rim first. So here is the torch. Gently pass it back and forth until you see some superficial melts. It melts slightly superficially, and then gently fold it and make sure that there is no space in between. This, no space. So do it again, back and forth, and then fold it. And then Cut it. Now we are going to fit it. Cut here. And also cut here. And also cut here. That's it. Put it in the center of the ridge. And if it is a city, then you need to draw the canine line and all those things. So just for just thinking that this is the city, that then you need this line. I'm going to show you. I don't have a red pencil, but let's use blue pencil for now. So draw the center line. It should be the occlusal rim needs to be centered here. And you also need to draw this line all the way from the center of the ridge across the center of the ridge, and also here. And also you need to draw the canine line. So this will be the canine line. Okay, so following these lines, we adapt this occlusal rim, and then we need to attach this occlusal rim on this. So since it is still warm and malleable, you can move it, you can mold it in the shape that you want it to be. And then once the adaptation is done, I'm going to hit the instrument and then attach this on this denture base. So hit the instrument and like this. Okay. Do it outer and also inside inner surface. Do the same. And also the front one. For the ideal height of the occlusal rim is the 2/3 of the retromolar pad. So it is important to mark retromolar pad, encircle it with a pencil, and draw a 3 line, 1/3 and 2/3. So this 2/3 is the height of the occlusal rim. So ideally, so the occlusal rim needs to be this height. Like this. So I need to cut all the way. almost like this, ideally. But it varies on the cases. So just to be aware of it. Okay, and it is best if you can make it flat when you are taking the jaw relationship and jaw relationship. But since I have a kind of stable bite, I'm not gonna do that. Since in this case, it is to support it, I don't need, and I also have a particular bite registration, so I don't need to have vertical dimension record and bite registration. So I'm going to put the tips right away. So yes. Tape. I wanted to put this. For me to see better with the central line, just remove the pin, and I want to achieve 2 mm over bite. And it'll be better if I reduce it here some more. So hollow twist nicely, firmly. Reduce this area, the lingual. And also you can reduce a little bit of cervical. Not on the enamel portion, but the root portion. Now then, let's fix it. I want to move it slightly more distally, slightly. Okay. And then let's move it to the next one. Let's check whether it has enough space for the next tooth. It seems like it does not have. Let's see. So in this case, I might make it a little bit more labialized so that we can have a wider arch and better tooth alignment. The bite is good. Okay, and then let's set the other side. See that this tooth does not have enough space for the canine because of lack of arch length. So it might be big. And also this canine is labially tilted. So probably we might keep tooth canine like this, or if the patient wants it to be straight, just make it straight. Probably we can make it a little bit more labially, creating better, more dimension. Bring the canine more inward, adjusting it until it is all together, providing the space of the canine. So I made it wider, I labialized it. I think it is too much labialization. Let's put them a little more up, up, up. Let's see. What does it look like? So it is almost closing the space, which is seen here. And I think this looks better. As you can see that the canine is higher than the premolar, so it is unusual. Let's set the posterior teeth. Before I put posterior teeth, let me just fix so that it will not move, so that I do not lose what I have done here. Fix the lingual surface as well. And then the base of the wax. Okay, let's move on to the posterior teeth. Melted. And get the posterior teeth. Let's see. So this must be in line with the line that I draw. So it should be on the center of the arch, and make sure that it is occluding with the posterior teeth. So make it higher and then press. And check with the posterior area. And we can elevate it using the harbor. Elevate the posterior area, making it bite well, occlude well with the posterior teeth. As you can see, the molar is straight vocally out. I think it is now occluding well. And since it has been edentulous for a long time, this one passively extruded. I think this needs to be trimmed. See this area. I'm going to trim with the acrylic bar. Still, it is high, so I'm gonna reduce more. Sometimes second molar is not considered to be replaced. In this case, it has a second molar as opposing tooth, so still. So if you cannot trim the tooth, we trim the acrylic denture base. Something is not occluding. Now I have one more tooth to set. Let's remove it, and then let's put the last tooth. Let's see what challenge I'm going to face. Here's the tooth. Like this. Let's put some wax. Mhm. Okay, it is removable, even though there are some wax undercut. Let's add some wax, make it thin. Make sure that nothing is interfering. Now yes, I have waxed it up. Now I'm going to use the torch to make it a little bit smoother. Now to the feasting. we're gonna still do the waist train. After waist train, I'm gonna do the final 15. So for this time, I'm gonna just do brief listening for the train. Again, this is not the final listening. It is just for the waist train. So I'm just going to do brief listening, and I'm going to do the final touch once the occlusal train is done, because even though I do final listening now, if I do train, I might change something. So I should not spend so much time and doing all over again. So do the final listening once it is done. Now what I do is just making it looking good enough for the patient to see. And of course, I'm gonna also inform the patient that I will adjust the beauty a bit more. And but since it is an aesthetic trying, you should not just make it ugly. I mean, you cannot bring it in any form. You have to make it pleasing. So interdental space, interdental root prominence, define it a little bit. And make it strong enough to withstand the patient's biting force. The patient will chew and try, so, but reduce, don't make it too bulky. Patient will not like it. Make sure that no wax on the ridge that is interfering with fitting the denture. Let's check with the articulation before seeing the patient. Okay, let's try on the patient.